Welcome.
Thank you.
Welcome all to the Accordo Chiropractic Podcast. And I have a really special guest today. Her name is Jamie, and Jamie is a nurse practitioner. We've been working together for some months now.
Yeah.
Right? Three. 3 months?
Yeah.
Yeah. It's been an awesome journey so far.
Fantastic.
Jamie is a nurse practitioner, and awesomely, her practice is right here in Greenbrier. We're like 2 streets away, which is amazing to have an asset like Jamie in the Hampton Roads, and particularly the Greenbrier community is super special. And Jamie specializes in women's midlife health. And after the podcast we did last time with Drew, we did the Fit Over 40. I had so many people asking me like, okay, well, what about Fit Over 40 for women? And so here we are. So Jamie, tell everybody about yourself. Tell us about your practice. How did it come to be? Why do you do what you do?
Man, how much time do you have? So I am a family nurse practitioner. I started out my career, I've been practicing for over 15 years in women's health, but I started out my nursing career in labor and delivery. I was a labor and delivery nurse. And that's all I ever wanted to do is just help moms and babies and deliver and breastfeed and do all the things. And then I thought, okay, I probably can do a little more. And so then I went back and got my master's and became a nurse practitioner. And I was like, I think I want to go back to women's health, but there was nothing like available at that time. So I started in family practice, and I mean, such a good, basis, just treating men, women, children. And then I did a little bit of emergency medicine. So I worked in the ER, and I was like, that's burnout. You feel like you don't help anybody. It's like herding cattle, like emergency, and then it's like, what happens to them afterward? Like, where do they go? Where did that person go? So I was like, there's got to be more. And then I ventured into gynecology oncology, so women with cancer, and it was so fulfilling and so rewarding, but also really sad. And then that's when I lived in West Virginia. So I'm from West Virginia, moved down here about 6 years ago, and came to an OBGYN office. I got back in women's health. And it's the grind, right? Patients in and out every 10 to 15 minutes, and you're just turning the wheel and, okay, what's going on with you today? All right, let's get your pap smear. Let's see you. And I was like, wow, there's got to be something more. Like, these women are starving for attention. They're coming in with 900 problems, and we have 10 minutes to address it. And then, I was just like, this is crap. And it's it's insurance-based medicine, and it's standard of care. But I was like, what else can I do? And then I thought, I could probably open my own practice. And so that's where kind of the Mama Coach was born. We're part of a bigger community of RNs and NPs, the Mama Coach brand, and each of us has our own private practice. So we go under the brand. And I started out seeing, the Mama Coach. It sounds like moms, moms and babies, but I started out seeing women postpartum, in pregnancy, education, CPR classes, breastfeeding support, postpartum support, mental health support. So that's kind of where it all started. And then I was like, I was going through midlife myself, and I was like, something's going on here, something ain't right. And I was like, I see that disconnect from women coming in their 40s and 50s, and like, what's happening in my body? I just don't feel like myself. And so that's why I was like, oh, let me expand this. So then the women's health side of it was born, and that's kind of where I'm practicing now. I'm really digging in deep there, midlife, perimenopause, menopause, and beyond, even women younger. I see kind of all women across the lifespan. So it's just my passion. It's what I want to do, and I enjoy it so much.
Yeah.
So that's how the Mama Coach was born. And
that is so cool.
Yeah.
So you have a lot of history.
A lot of history.
Yeah, that's super cool. And the nice thing about being able to draw on so many experiences is that you really get a really well-rounded kind of idea of like, what's out there and what's going on and what are the challenges. Yeah. So I have some very much women-specific questions for you that I absolutely want to ask on behalf of all of the patients watching this and all the people watching this. But like, you were talking about how you felt like there was something missing. in healthcare in general. So what was missing for you? What was the problem? What was broken?
I don't know if there was just one thing, I think it was multiple things. I think it was, one, women weren't given enough time. And when I say women, this podcast, our conversations about women, but I think in general, our population as a whole, women, men, children, we're all underserved in certain ways, but time is such a limitation, right? We only get so many minutes with each patient, and when that time is up, it's make another appointment. Wait, I have to come back again. I have to take off work. I have to take time away from my family, and you're only working this many hours. So it was very much that time restriction, and then not enough time to be able to provide adequate education for these people and tell them what was going on with their bodies and explain why they were feeling and validating them. It was just, okay, you're here for your pap smear and your breast exam. Here's your gown, get undressed. And I mean, obviously it was more than that, but that's what it felt like every single day. It just kind of the same thing. And then I see all these women with more problems, and I'm like, I don't have enough time to help them. So really it was time.
Yeah,
it was time.
Not enough time to really help them.
Yeah.
So you mentioned two things: insurance-based healthcare, and then you mentioned standard of care.
Yeah.
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 So those three things that you mentioned, so time, insurance-based care, and standard of care.
Yeah.
I absolutely want to have a whole podcast about just third-party reimbursement and how it's destroyed healthcare in our country. How there's not enough physicians, but there's, way too many administrators, because all of the providers and all of the healthcare practices are just running around trying to file paperwork to chase after insurance reimbursements. Yeah. And, we found in Vietnam that what you measure becomes what's important. And when you're in insurance-based practice, you're not measuring improvement.
Right.
You're measuring visits.
Right.
You're measuring services.
Yep.
You're measuring insurance reimbursement.
Yep.
And it's hard to give quality care when, let's say you bill a $100 service, right, and you get $30, right? Well, how do you fill that gap? Well, unfortunately, the way that our healthcare system is, functioning now, with 90% of people's healthcare paid for by a third party, and the government really takes a lot of that on at this point too, which is even a sadder state. You see more volume.
Yeah. Well, reimbursement, even less for nurse practitioners.
Oh yeah. Oh, trust me, I'm a chiropractor, so you don't even gotta.
I mean, it's not an even playing field by any means, and yeah, so it is. It's unjust. It's unfair. It's. How do you fix the problem? I don't know. I mean, we're just...
Blow up all the third-party reimbursement companies tomorrow, and then healthcare gets fixed in a year.
Can't say that online.
I mean, I'm going to say it because it's the truth.
I know. No, it is the truth. It is.
Yeah.
But it is like, you look at other countries too, but the problem's not solved by socialized medicine.
Well, no. So it just puts gas on the fire.
For sure.
100%.
So there's so many problems, but that's kind of where, these cash-based practices, and you're able to spend more time and give the quality of care for what you're worth. It's, there's more out there.
Yeah, there's more out there. Yeah. There's more out there. So what are the challenges and the obstacles that women are faced with in midlife?
Ooh, okay. So, women have jobs, they have families. A lot of them are primary caretakers, and they work in the home, they work out of the home. They're taking care of the kids and along with their partners. But when you start to get in this transition of midlife and your body starts to change in different ways, and you can't cope the way you did, you can't deal with things the way you did before, you're like, what is happening? I don't feel like myself. So everything around you changes. It's not just you that's going through it. It's your kids, it's your husband or your partner, it's your job. All of these things are affected. You're getting, just brain fog. You can't think. And what I hear from women all the time is I can't even pinpoint my exact symptoms. I just don't feel like myself. I am full of rage. I am irritable. I am exhausted. My joints hurt. My back hurts. I am not performing at the gym like I was before. My gains are not what they were. My sex drive, the list goes on. And then all the really weird symptoms that start to pop up, like my ears are itching. I get this weird metallic taste in my mouth. And where's this rash coming from in my body? My gut is just destroyed. I don't tolerate food like I did, So these weird symptoms, they don't know where they're coming from. And it's, all deeply connected as our body goes through these hormonal and physiologic transitions. When we're talking about women after having babies because that's what starts it all, right? So postpartum and menopause are like these two big moments in our life where our hormones just are wildly fluctuate. The biggest physiologic drop in our hormones happens right after the placenta is delivered. You have a baby, that placenta comes out, and your hormones are shot, they're gone. And that's the biggest physiologic hormone drop in your whole entire life. And so what postpartum care is brought down to is one follow-up visit with your doctor, 4 to 6 weeks. You're healed, you're back to normal, go on your way.
Right, whereas like all the cultural knowledge and understanding that, civilizations that we've come from and cultures that we've come from. So I'm very Italian, right? All these ancient cultures would have support built into the culture around a mom who just gave birth.
Yeah.
And here, it's almost like we've tried to replace that culture with a paid service.
Yeah.
Right, and it's just not there, not right.
It's where that saying "it takes a village" comes from, right? And it really does. And women, as we're having babies later in life, it keeps happening. Later and later, women into their 40s are still having babies, and then right after that transition, you're going through midlife, like literally the perimenopause transition is directly after they're having children. So you're going from one hormonal state to the other, physiologic change, body, mind, spirit, if you will, mental, everything. So it's all encompassing, and women are struggling, but postpartum care is really coming down to a single visit with their doctor, a depression scale that they rate. You circle how you're feeling, but it doesn't tackle the anxiety that comes from that. Let alone the partner education. Like, how does your partner help you in this period? People don't understand. Did you get any education after your wife had like your first baby? Did you know what to do? Did you know? Did you take a class? Like,
did I know
did
what
you know
to
what to take care? Like, did you know how to take care of her? How to support her?
I watched a very important video about not shaking the baby.
Okay, fantastic. So important. So important.
That was about it.
Okay, yeah, and the rest is like, this is where education. It's like, where did it go? Where did we go wrong? And you can take a birthing class and you can take a prenatal class and you learn some of it, but it's just like this woman, this being just birthed this beautiful child, and you're so overjoyed and you're like, I love this baby, but then you feel like, what is going on with my body? I can't, I've got to take care of this child. I've got to do this laundry. I've got to make dinner. I've got to take care of other kids. I'm going back to work in 6 weeks. How am I going to make enough milk to, So all these things, and it's that hormone drop, and we wonder why we don't feel like ourselves. Estrogen is non-existent after delivery, especially if you're breastfeeding. A low estrogen state, so joint laxity. Estrogen makes that our joints more lax. So in order for the baby to come through the pelvis and deliver, that's the natural thing. So women with back pain, I'm sure you see it.
Oh yeah, for
pregnancy, postpartum, all the things. And so these hormonal fluctuations kind of drive all these other symptoms, mental health concerns, depression, anxiety, estrogen receptors are present in, so many organ systems in our body, our brains, our joints, our cartilage, our tendons, our gut, our skin. So it's big changes.
So if I'm understanding this right, we've got all of the cultural factors that are an issue, where a lot of times women are being asked to do a lot more than historically they've ever been asked to do. So to not just be totally present and perform in the home and on the home front and for their spouses and children, but also to perform and show up and hold down like the career front as well. And that's a lot to carry. And I think at some point we kind of got to start asking ourselves these cultural questions about like, is this the right way forward? And obviously everybody's going to come to their own conclusion about that one, but it would be, I think, unfair to say that it's not a real challenge not a real obstacle to kind of overcome to stay healthy as a whole person. And then physiologically, you mentioned a couple of key changes. So what I heard you say is that after every birth, as soon as the placenta is delivered, hormone levels across the board for everything just tank. And I think that's because the placenta is a big hormone producing organ system. Right? And so when that's gone, then the body has to be like, okay, now I got to restart all the factory inside to start, making these hormones again, not in the way that they were before. And I can't even imagine what kind of roller coaster that feels like. So that happens for every birth. And then we get pre and, current you get premenopause, menopause, and then postmenopause, which is another huge hormone fluctuation. So literally like all the signals that your body cells, body parts are getting just wildly change. Okay. Yeah, that's a lot.
So, perimenopause is the transition into menopause. Menopause is literally one moment in time. The day that you are without a menstrual period for 1 year, that is menopause. And then the rest is postmenopause for the rest of your life, postmenopause. Perimenopause starts about, on average, 10 years before that 1 year without a menstrual cycle.
Does that vary wildly for each individual?
Of course, yeah. But we say on average, we say 10 years so that, because these women that are coming in their 30s, you're too young for perimenopause. Not necessarily. Like, let's say your last period occurs when you're 45. I mean, we classically go by if they have the saying, ask your mom what her menopause was like, and that's how, how it was, and that's how you'll follow in her footsteps. Not always, but I mean, so if you have, women in your family that classically went into menopause a little bit earlier in their late 40s or even in their late 50s, that's going to be very different than for each woman. So you have no idea when a woman's last menstrual period will be, whether it be natural or surgical, honestly.
Right.
So we see this, so basically at 35 to 45 is when perimenopause can start on average. But 40s is when we see a lot of the big changes. I felt like when I turned 40, I was like, woke up on my 40th birthday, who am I? But, it's different. So as you transition into that, the first hormone to usually drop actually is testosterone in women. In our 20s, it starts to decline. Then progesterone. So progesterone's our calming hormone. It helps us sleep. It helps our mood, us be calm. That's why we get so ragey, right? It's
good to
progesterone.
Know. Good to know.
I'm telling you, all these, right? You're going to see women in a whole new light. And so progesterone is slowly falling off, and then estrogen's doing this. So estrogen actually goes wild before it declines. And so this relationship that estrogen and progesterone had when you had normal menstrual cycles, they kind of break up. They're not friends anymore. So you have this term called estrogen dominance, and really it's more of a progesterone insufficiency.
Okay.
And so you have this disconnect between your cycles. You're having longer or shorter or heavier or more painful cycles. And then that's where the brain fog and the fatigue, trouble sleeping, insomnia, 2 to 4 a.m. wakings, and you're like, why am I awake? Cortisol spikes. So cortisol and progesterone, they compete for the same receptor.
Interesting.
Pregnenolone, that's a tongue twister. So they compete for the same receptor, and when your cortisol's high and the progesterone's low, it's constant battle. So the cortisol goes up. So oftentimes, if we try to treat the cortisol spikes, chronic stress.
Yeah. So let's talk about cortisol for a little bit.
Yeah, let's do it.
Because our audience might not know anything about it.
Yeah.
So what is cortisol, and what role does it play physiologically under normal, healthy circumstances?
Yeah, so cortisol is it's a hormone. It's part of the hypothalamic pituitary adrenal axis, which is like this neuroendocrine system that manages stress response. Mm-hmm. So you hear about the fight or flight or the rest and digest. That's where these hormones kind of come in. And oftentimes women's hormones, they are deeply intertwined in that axis. So small fluctuations in our estrogen and progesterone can affect our HPA axis and then throw our cortisol off, either high or low. And then that affects our stress response. So sometimes we feel in this constant state of fight or flight. Like we constantly feel anxious and like bad's gonna happen, like this feeling of dread. And there's so many other things that when we're talking about fight or flight and things that affect that. I think we talked about one time the relationship between like not sitting down for dinner and just like letting your body like rest and digest, right? We're standing up to eat, we're eating on the run, we're eating 10 minutes and like that, the whole gut thing. But that's what cortisol is. So cortisol is, you might want to expand on it.
I always try to like really simplify everything. Yeah. So cortisol. There's a lot of big words there.
Yeah. Right?
Cortisol is like a stress hormone.
Yeah. It is. Mm-hmm.
And so cortisol is produced in response to stress. And now we live in this culture where a lot of times we're under chronic stress.
Yeah.
And the thing about stress that I think everybody really needs to understand is that stress is personally relative. Mm-hmm. And so what I mean by that is your body doesn't really know the difference. If you've only experienced XYZ stress, right, that's your 10. Okay, and if the worst stress you've ever had was, let's say somebody's had a pretty, non-eventful life, mm-hmm. God bless them, and the worst stress they've ever had is like a car accident, right? So there's your 10.
Yep. Okay.
Well, being late for work might register on your personal scale as like an 8. Mm-hmm. So the body doesn't really know the difference. Mm-mm. If you've never experienced literally running away from a bear, right, or fighting for your life in a literal kind of sense, right, your scale, your personal scale is going to register higher on those stresses. So now we have this culture where we're under a chronic 8 because everything is registering really high on our personal mm-hmm. stress scale. So now you've got, chronic stress, mm-hmm. chronic cortisol. Yep. And the problem with when you're under stress is that your body is really good at prioritizing what it needs to do. Mm-hmm. So if I'm fighting for my life or running from that bear, or if I'm just in a car accident, right, my body's not really concerned with digesting food as much. It's not as concerned with repair. It's really geared up for survival.
Yes.
And so the cellular mechanisms that my body's going to undergo are going to be ones that are geared for survival. Yep. So a preferential treatment towards storing calories as fat, if I'm worried about survival, is a big priority.
Yes.
So it's really easy to pack on extra pounds if you're under chronic stress, because your body's like, I need to keep this for later because I don't know if I'm going to eat again ever. For sure. And interestingly, we live in a society where that's never a problem.
Never a problem.
Our next meal is right around the corner every single time. And now, I'm not saying that's for literally everybody in the country, right? But for most people, right, the next meal really isn't an issue. So your body's going to preferentially store fat. Mm-hmm. It's not going to enter that rest and digest mm-hmm. where healing happens. Mm-hmm. And so then we start to see this chronic breakdown of tissue quality. We start to see this chronic breakdown of joint quality, muscle quality, because you're not building during rest and digest when you're trying to survive.
Right.
So what types of things would you think if you were to talk to somebody and I'm like, Jamie, I want a top 3 list of the things that I can do to help regulate my stress, what would those 3 things be?
So I would say first, you have to focus on the mind, meditation, breath work, calming your body down when you're feeling overwhelmed. So working on those techniques, whether it be going out and for a walk, yoga, meditation, breath work, just like going in a dark room and sitting and breathing deep, trying to handle the stress or manage the stress that you're feeling with that mind-body connection, because everything is connected. I honestly want to say boundaries. Like, boundaries. Women have a problem saying no. And the more we take on, the more stress it causes. So creating these boundaries, especially in midlife when you have 5 million things going on, is so important. It's okay to say no. It's okay to decline the dinner party, the whatever it is.
Yeah,
I'm not going to any dinner parties, but I
mean,
it's okay to say no, or to take on one more thing on your plate. Like, if you physically, mentally cannot handle one more thing, it's okay to say no. So creating those boundaries. Top 3 you're giving me, really. Moving your body, movement, like feet on the ground, sunshine in your face, like just being one with nature, if you will, like getting out into the world, just getting some sunshine, setting a circadian rhythm. And part of that is sleep, right? Consistent wake times. And we all don't go to bed at the same time every night, and we all don't wake up at the same time, but, well, we kind of...
That kind of goes along with those boundaries too, right?
Yeah. So,
boundaries around when you're going to go to sleep and when you wake up. Yeah.
I mean, those are the foundations, trying to manage the stress with some sort of mechanism, mind, body work, breath work, meditation, moving your body, because, common sense tells us you're laying around, it's going to depress the heck out of you even more. Yeah.
It's so funny how we take common sense out of so many of our conversations. So I'm hearing that the top 3 is, number 1, setting aside time specifically to develop strategies to help calm down.
Correct.
To breathe.
Yep.
Process the stress.
Yep.
Let it pass through you so that you can function. And making sure that you set healthy boundaries for yourself, so you're not taking on too much, and making sure that your priorities are straight.
Yeah.
Okay. And then the next thing is going to be moving your body. What types of exercise is going to be the most beneficial for a woman in midlife?
So I will say there's going to be no bigger return of investment than strength training for women in their 40s and midlife. But that being said, when we talk about stress and cortisol, there's good stress and there's bad stress, right? And so if you are chronically stressed and you are hitting the gym every morning and trying to do this HIIT workout, and then that's going to actually drive your cortisol even higher. So, you think, I'm going to move my body, I'm going to do this workout, but then you're like, I don't feel any better, because you're already at a 10.
So the high intensity training could be counterproductive in midlife for a woman. I think that's huge for everybody to really hear.
Yeah.
And that if your cortisol's already spiked, you're under chronic stress, those HIIT workouts really aren't helping you as a woman in midlife. And so really slowing down, not jacking up the heart rate, and just lifting heavier at a slower pace.
Lifting heavy.
Yeah.
Honestly, bone, metabolism, mood, immune system, like the muscle, fat loss, insulin resistance. Like, what else? It's everything. Muscle is everything. It's the building blocks, and protein, the building
protein
blocks
intake.
of
Yeah, we're totally going to talk about some nutrition
Sorry,
stuff.
I'm getting on.
No, it's all good. We're totally going to talk about some nutrition stuff. Okay. So really important during midlife to make sure that we're not living under chronic stress.
Yeah.
And that we are managing the stress that we are under in the healthiest way possible is going to be huge.
Yep.
And that way, as progesterone is dropping off, we don't have all of this cortisol kind of competing for that space. Because if there's less cortisol, then the progesterone that you do have can absolutely do the job that it needs to do and kind of keep your hormones in better balance than if you're in chronic stress.
Yep.
Okay.
Yeah.
That is absolutely huge. Love that.
Yeah.
So we talked about exercise and how weight training and lifting heavy weight is super awesome. And y'all, heavy weight is relative, right? So if a 12-pound overhead press or whatever is heavy for you, that's heavy weight. So don't feel like you got to use, the big kid weight to lift heavy. Just making sure that you're lifting heavy and kind of progressing along that route is going to be huge.
Exactly.
And then you mentioned walking. I love walking.
Yeah.
I wish I did it more.
Yeah.
We live in a car culture, unfortunately, but I do enjoy the act of walking.
Yeah.
What are the benefits?
So first, cardiovascular. Just a brief little teaching moment. Women over 50, when compared to men, we have a 2 to 3 increased risk of cardiovascular disease compared to men.
Really? Which is weird because men are the ones that get all the heart attacks back in the day.
But in your 20s, 30s, yes, men are higher. But in midlife, women, their risk goes up.
Wow.
Cardiovascular disease is the #1 killer of women.
Whoa. Okay.
So heart benefits, right? So walking in, about 150 minutes a week, whether that's broken up into 3 days or 7 days or 10 minutes in the morning and 10 minutes at night, on your lunch break, wherever you can get in a good brisk walk, you should do it. Walk your dogs, walk your kids, walk your kids. Yeah,
stick them on the bikes,
on
rock
the
and roll.
leash.
Yeah. I was so anti-leash as a parent. But then I had twins, and I was like, there might be something to this leash thing. Is they're both going like 2 separate directions? I was like, I might think about the leash.
So the truth, yeah. We
didn't do the leash, but I was very tempted.
No, yeah. And maybe putting on a weighted vest during those walks.
So the weighted vest, we're seeing it everywhere, and millennials are
everywhere.
Like all over this thing, which is great. What's the benefit of the weighted vest, and why does it make it better than walking without one?
Yeah, so you're adding a little bit of extra weight to your walk. So it's like burning more calories, better metabolic response, but also for muscle building and bone health.
Nice.
Where those things. And alone, it helps my posture. I feel, that vest, it really kind of brings things back. But if you're seeing these women walking with vests in your neighborhood, they're in perimenopause for sure. Give them a shout out.
I'll say that it's really amazing for your posture, and if you are going to take on a weighted vest type of exercise routine, you need to actively hold yourself in that posture, because the weighted vest can really, if you're not, it can really ruin a lot of stuff too. So maintaining proper posture while you're walking with the vest. I'm all about that.
You don't have to start out with a vest, of course. Just walk. But if you want to up your game a little bit, incline or put a weighted vest on, some ankle weight,
And then for all the dads out there, if you need an excuse to buy another, tactical vest with some plates, there you go. We got it.
Lord.
Got the excuse.
There you go.
Wifey needs a plate carrier. That's all I needed to hear. Let's talk about rest and recovery.
Yep.
So how does recovery requirements, how do our rest requirements and recovery requirements change as we crest 40 and we're looking at that midlife? How does that change?
So I think that overall our body needs more time for rest and recovery because we're already going through chronic stress, hormonal fluctuations. Our as our hormones are declining, there's receptors in all of our joints and all of our ligaments, our tendons. We get more injury, right? So we're more likely to have an injury because of that joint laxity, and so we're able to do all of our normal exercises in our 20s and 30s. Then we get a little older and we don't bounce back as quickly.
Yeah. So I like to talk to patients about healing speed capability. And so like if we take a 21-year-old and we plot them on this graph, and let's say the 21-year-old has 100% healing speed ability, right? An infant is going to have 200% healing speed capability. And as we age, it's not that we don't heal, because the body is always healing, and that is so paramount to what we do here at the practice. The body's always healing. However, as we age, incrementally, year after year, healing takes longer. So as we're aging and that healing takes longer, if we don't take that time to allow our body to heal and give it the proper tools that it needs to heal, stuff's not going to heal, and we're going to get injured. Every time. So really setting aside that time for that rest and recovery. And I do want to take this opportunity to talk about some passive care type things that are super beneficial. So you've been getting adjusted for like 3 months. What are the changes that you experienced through getting adjusted?
Oh man. So I feel like, I knew you were going to ask me this question, and I thought I was going to be prepared, but I think, the level of pain obviously has just been reduced. I used to feel this just enormous amount of pain in my neck and my upper back, and to the point where it was preventing me from doing the things I wanted to do, just the simple tasks, standing and making dinner, you know what I mean? Let alone working out, lifting heavy, those kind of things. So pain reduction has been tremendous. And I feel like the muscles around my spine are more relaxed. And I think it's just a matter of, you're adjusting that. You know the physiology of it, but for me, it's just like I don't feel as tight in that area. And then doing all the things that you watching the workshops and posture, being mindful of. We're constantly on our phones, and just the things that we change, that you help us to change and be mindful of. Before I wasn't really as mindful, being on a computer all day, doing telehealth or seeing patients online, typing, charting. I've just changed so many things in my daily life that are helping support my adjustments and making me feel better. My brain fog, I will tell you, it's wild. Like, I feel clear, not every day. But
you just started.
There's multiple. There might be other things going on.
Factors.
Yeah, I didn't sleep very well last night. All the things. But this clarity, you feel like that, like this fog has lifted from my brain. My mood is better. I feel lighter. I feel happier. I feel like I can see the light. You know what I mean?
Yeah. That's beautiful.
I think the first time you adjusted me, I just broke into tears. Do you remember that?
Oh, yeah.
Well, I'm sure I'm not the only patient
you are not the only
yeah.
one, but I don't ever forget.
But it's like...
Yeah, it's special every time.
I will never forget that. It was like this... I was like a little dizzy, sat up, and then all of a sudden, it was like this release and just tears. And I thought, what is going on? I said, I'm sorry, I didn't expect to cry. It's going to make me tear up again. But it was an experience. It was crazy. And then every time, I'm like thinking, can you become addicted to chiropractic care? Like getting adjusted? Is that an addiction? Like, is that my strange addiction? I'm addicted to getting adjusted. Because you just feel so good when you leave, and you feel like, I can tackle the world. I can do this.
Yeah. So when you were talking about the interrelationship between our hormones, the organ systems that produce and manage those, and the nervous system. The key is right there. So a lot of times people think that chiropractic is like a musculoskeletal thing, right? And we're bone doctors, or maybe we're muscle doctors, maybe we're joint doctors.
Yeah.
But it's really not what's going on. Chiropractors are nervous system doctors. And the nervous system, as you know, but I'm just, for everybody else, the nervous system controls, coordinates everything. And when your brain is getting accurate information, because those pathways are clear, and then what your brain needs your body to do, those signals are accurate and clear, the body just works better.
Yeah.
So yes, are we moving joints that haven't moved in a long time, and does that feel nice, and can you move better, more fluid? Are you lighter because the joints are moving? Yes. As the joints move better, do your muscles move better? Do you have better range of motion? Does movement just become easier? Yes, absolutely. But the biggest things come from a nervous system that is free and clear of interference, so your body can do what it needs to do. And that really complex interplay of all these hormones that we've talked about. We've only talked about a few, right? There's a gajillion more, right?
Yeah.
And the relationships are infinite. We're just beginning to scratch the surface of understanding about how the body really works. That's the biggest thing.
Yeah.
That's the biggest
and
thing.
You've taught me a lot about that, when we had our first class and we learned about all the nervous system. Took me back to pathophysiology and, in school. But I mean, you don't learn about, you don't think about those things.
Yeah.
You're like, I'm just going day to day. My body's supposed to do what it's supposed to do. But no, I mean, if it's not in alignment, that nervous system, the signals are going to be completely just jumbled and not able to transmit the way that they need to and they should.
Yeah.
But it's very interesting. It's
yeah,
very interesting.
Super cool. I love the magic. So what other things have you seen women in midlife do really well with, like massage, Pilates, yoga? What types of things do you see women do really, really well with, apart from chiropractic?
Yeah. I see a lot of women that yoga, stretching, because we just are, we don't stretch our bodies enough, and then our movement, our joints don't, motion is lotion, right? So moving those joints, stretching those joints is very important. I see a lot of women taking on yoga and loving it.
And that's great too, because it's very meditative in nature.
It is.
Right? So
And
it does that double duty of like moving the body, right? Cardiovascular system, reducing stress, and then you can just be totally present and help process that stress. Yeah. It's kind of like that physical meditation for sure.
And I think, honestly, just telling women and letting them know, like, you may not be a person that can do high intensity exercise the way you did in your 30s. Like, it's okay to take a step back and to take a break and tone it down a little bit, Yeah. For our hearts, for our minds, for our hormones, all the things. But yoga, physical therapy, pelvic floor physical therapy.
Pelvic floor. Dude, that's so important. Yeah.
I mean,
pelvic floor. Well, the pelvic floor is the bottom of your core. Right?
Yes.
So if we look at the core, right, let's imagine like a can, soda can or a trash can or whatever. So you've got the sides, and that's your core musculature that, live right around your spine. You've got the top, which is your diaphragm. Yep. And then you've got the bottom, which is your pelvic floor. Yep. And if your pelvic floor is weak, you can't stabilize the core, because if you pressurize the top, it's just going to blow out the bottom. Right? So that pelvic floor is huge. And so why is pelvic floor such a big deal for moms or women really in midlife?
Yeah. Well, I mean, it is, again, it's that stability. It is the basis of everything. We're walking on it. We're sitting on it. We're going to the bathroom and we're having sex. I mean, these are all things that involve the pelvic floor. And the first thing, whether you've birthed a baby or not, is the pelvic floor. Postpartum, nobody focuses on that. Like, you're like, oh yeah, I'm kind of peeing myself whenever you go to your 6-week checkup, and you're like, I can't control my bladder. Oh, it's fine, you're postpartum, it'll come back. Does it ever really? I don't, it's been stretched, it's been maxed out, and those musculature, just like any other muscle, the pelvic floor has to contract and relax and build back up, just like our biceps and our triceps and our quads. And if you want to build that muscle and keep it strong, if you don't use it, it gets weak.
Yeah.
And after a baby, it's very weak. And so something that women in other countries, they get an automatic pelvic floor PT referral. We don't get that here.
Yeah.
We have to maybe ask for it, or maybe it's not even like on our, we don't even know it exists.
Right.
And
yeah, I think there's a huge blind side there.
Yeah.
In terms of just ignorance.
Yeah.
And the childbirth thing is huge. Mm-hmm. And that's where most women are going to be exposed to the idea of like a pelvic floor therapist and really work on getting that strong again. But even outside of childbirth, and this is for men too, because pelvic floor is super huge for us.
Yep.
When we sit, right, our body doesn't automatically engage that pelvic floor, right? It doesn't. It lets it go. Mm-hmm. And just like you said, if you don't use it, you lose it. Mm-hmm. So pelvic floor is super huge for everybody, but yeah.
And then all the chronic things that you're doing day to day, like just sitting on a toilet, we're hunched over, our feet, putting our feet up, getting in a better position. I will die on this hill. Squatty potties, they're it. It's it.
Yeah. So I've got a better hill to die on. Not better, let's just say different. In some countries, the toilet is actually in the floor.
Really?
Yeah. So not every toilet in Italy is like this, but some toilets in Italy that I've been to, the toilet is like in the floor. Whoa. So it's like you look at the floor and then there's like a cutout, right? And there's like tile, but the porcelain is under the floor level.
Yeah.
Right? So you literally have to squat. That is the best experience I've ever had going number 2 period ever.
Really?
Just saying.
Oh my gosh.
So the squatty potty is nice, but you're still sitting.
Yeah.
The best thing would be like a squatty potty that's like literally toilet bowl level and you could like squat.
Yeah.
That would be like probably the best ever.
Yeah.
But then, you've got that unfortunate long drop to the water, which no fun.
Oh my gosh.
Logistics.
My gosh. Yeah.
Logistics. But sitting to defecate is not a natural position for the human body.
And then you're straining and then weakening those pelvic, it destroys the pelvic floor. And again, like all the things that we're eating that are causing us digestive issues, constipation, diarrhea, straining to go, and then, women that have had childbirth or even just like a pelvic surgery, like surgeries, genetics on its own can cause, pelvic floor dysfunction. And so it affects so many things, not only just like peeing and pooping, but sex, walking, just the simplest of tasks can feel really rough when your pelvic floor is a mess.
So yoga, PT, specifically pelvic floor PT, anything else that you see women do really well with implementing in like a passive care or maybe an active care, but professional help type of care setting?
Yeah. So my office is within a massage office as well, and massage.
Yeah, massage. Love it.
Along with that, maybe some acupuncture.
Yeah.
It's cool. It is really cool. It's because acupuncture actually, there's some science base behind it helping with like hot flashes, vasomotor symptoms, and I think it's the skin, the neurological system, that whole thing, and how it modulates how our body responds to temperature and all kind of cool stuff.
Yeah.
But I see those kind of integrative therapies. But I will say that, I think, dare I say that I think every woman could probably benefit from chiropractic care and physical therapy at some level.
Yeah, absolutely.
If nothing else, just knowing even a pelvic floor physical therapist letting you know, like, these are the exercises to do, and then going home and doing them, just teaching you how the body works and how it helps those things. As far as, integrative care goes, I think those are the...
Totally agree.
Yeah.
Let's talk about nutrition.
Yeah.
Okay. So the challenges out there to eat right They are multiple, and they are big mountains to climb. What advice would you give a woman in midlife to start the process of like thinking about how to eat better? What types of things should we be looking for? What types of things should we be eliminating? What type of schedule should we be on eating? Is intermittent fasting a thing for women in midlife? Like, let's get into some nutrition.
Yeah. So I will say that prioritizing protein is my number one. We are chronically under eating protein, and it does us it's a disservice to us, to men and women. I mean, protein helps to build muscle. It keeps us full, satiated, so we don't overeat. It's good for our metabolism. It's good for our brains. So it has so many good things, but we are chronically under eating protein. So every plan that I ever put a woman on, I'm having them look at how much protein they're taking in, and I will guarantee you that we can always do better.
Yeah. So let's just take a quick aside.
Okay.
And talk about what is protein. So if we're going to make this super simple.
Yeah.
All right, super simple.
Yeah.
All right, carbohydrates, which, sugar is a carbohydrate. We can think of carbohydrates as like fuel. We can think of fat as like hyper-concentrated fuel.
Yeah, I like that.
And
high
then,
octane.
Yeah, high octane. It's like hyper-concentrated fuel, super important. And then fats also really help like with a lot of other functions as well, but just bare bones basic here. And then proteins are the building blocks.
Yep.
Right. So if we're not eating enough protein, we're literally not putting enough building blocks in our body to heal and function in the way that we need to.
Correct.
So the protein is like the number one thing you're going to be looking at for a woman in terms of her nutrition.
Yep.
Okay, that is awesome. What other things are you looking at?
Fiber.
Oh, fiber. We did have a nice talk about gut health earlier before the cameras even started rolling. So why do we need fiber?
Oh, so many things. So fiber, it helps us eliminate waste out of our bodies. And we have prebiotic fiber, and we've got, there's different types of fiber, but the first thing is prebiotic fiber. So that is kind of our the cleanse of our digestive system. It if you think about it, it's like psyllium husk. Let's take that. It expands with water. So fiber and hydration are going to go key and key, right? Hand in hand. You have to drink water with fiber, but that aside, fiber, that psyllium, expands in water, and it kind of like pulls all the nastiness out of our bodies, and also helps to repair the lining of our gut. So we see, I don't know if I want to go into leaky gut yet, and maybe we're not there, but it's, the act of getting rid of toxic waste and then keeping the gut barrier so it's not permeable, so things are not able to get out of it.
Yeah, so I think this is a great time to talk about leaky gut, because a really awesome and important thing about prebiotic fiber as well is because that's where the bacteria, the good bacteria in your gut, will proliferate, feed, and live, right? So you can do all of the probiotics you want, right? But if you're not eating enough fiber, they've got no place to be.
No place to go.
Or no place to live.
Yeah.
Exactly. And interestingly, the number of bacteria we have in and on our bodies, right? It outnumbers the cells in our bodies by about 100 to 1,000 to 1.
Ooh, I didn't know that. That's a fun fact.
Bacteria are tiny, right?
Very
and
tiny.
there are a ton of them in and on our bodies, and they're extremely important. So what is leaky gut?
So it's actually, the permeability, increased permeability of our intestines. So as there, we have a barrier. Think about a garden hose, and then think about poking a bunch of holes in that garden hose. And things are, they're still moving through. You still get water out the other end, but everything that's coming through the hose is now being dispersed into your body system, your bloodstream.
Right. And if we're talking about the gut, that can be waste products that shouldn't be in our body, right? That's going to be huge for our immune system. It can be not completely digested food molecules, right? So if your body's designed to handle like little tiny molecule A going into your bloodstream, and then we're going to use that, if ginormous molecule B goes in there, well, how does your body deal with that? And it's our immune system's job to deal with that. So we're dealing with a lot of issues with autoimmune disease. We're dealing with immune hypersensitivity. We're dealing with a lot of that stuff, and a lot of that stems from that gut permeability. So things are getting into your body system, into your bloodstream, if you want to think about it that way. There's things are getting into your body system that shouldn't be there because it's coming in through the gut. That should be this like nicely kept gate where everything that needs to come in will, and nothing that shouldn't come in won't. And that gets destroyed. And so that really good prebiotic fibers can help repair that gut lining, going to help protect our internal microbiome of all those good beneficial bacteria that we need. And that's huge.
Let's talk about the estrobolome. Have you ever heard of that?
Tell me more.
I didn't make up the word, but estrobolome. So it is this community of good and the community of good and bad bacteria in our gut that is controlled by our hormones, our estrogen, and so that's where estrobolome comes from. And so as your hormones start to decline and or fluctuate, this dysbiosis, the bad bacteria overgrows the good bacteria not enough, and so estrogen kind of keeps it all in check. And as estrogen says, "Peace and out," so does some of this community of this beautiful flora in our guts.
I don't get mind blown often, but I always enjoy it. That's so cool. That's so cool.
So I mean, it's definitely, and this is where we see women they get acid reflux, right? Like, I've never had acid reflux. Why am I having heartburn? Like, where is this coming from? And it's oftentimes a dysbiosis problem, and we're putting people on Pepcid and Protonics, and here's a medicine to treat the stomach acid, but we need stomach acid. It's so good. It's a purpose.
And it's a catch-22 because your body's producing stomach acid because we need stomach acid to digest food, right? And then if you take a pill that's going to artificially suppress the stomach acid production, your body responds to that by producing more stomach acid. So then there's this problem that continues to snowball. So artificially suppressing the body's innate reaction to things is not a solution. It's worse than a Band-Aid.
It is.
Because it makes the problem worse.
Because you don't even look for the root cause. Like, I've been having some heartburn. Take a Pepcid. Which also brings us to this new trend. Have you seen these women taking Pepcid AC and Allegra?
Together. So Pepcid is a really interesting chemical. It actually kind of enhances the function of other things that we take. And so Allegra is a histamine blocker, if I'm not mistaken. So in the emergency medicine world, and you're probably familiar with this too, but we would carry Benadryl and Pepcid because Benadryl is also a histamine blocker. And the Pepcid would actually help the Benadryl work better. So if you're dealing with somebody who's got a severe allergic reaction going on to like a bee sting, right? We don't want that person to die. That combo is pretty freaking effective. So tell me about what's going on with this Allegra and the Pepcid.
So, and you might see on social media or Instagram or TikTok, these women, a lot of them are midlife women, and they're like, there's something wrong with my body. It's fighting itself. I feel inflamed. I feel swollen. I feel like these weird rashes, like all this stuff is going on. And so they're saying that Pepcid, AC, and Allegra, both histamine blockers, are like, they're making them feel so much better. It's like unlocked this, it's like the key that unlocks this lock that, makes magic for them. But let's talk about what's really happening. Why are you having this histamine response in the first place? Combination of estrogen fluctuating and decline, leaky gut, dysbiosis, so yes, it will make you feel better. It's like, wow. but again, it's like putting just a Band-Aid on a gaping wound. It'll stop temporarily, but you're not looking deeper as to like what the body is actually going through. So it's, I mean, I think that I know what pills can do, and I know what they can't, and they can also mask a lot of problems.
Yeah, and they can make a lot of problems a lot worse. Yeah. 1,000%. So we talked about protein, talked about fiber.
Yeah.
Both of those super huge.
Yep.
What else? What would be the next line of kind of tackling a nutrition overall?
Nutrition. So then it kind of comes down to, I like to add things before I remove things, because it's a lot easier to get more protein and more fiber than tell someone, sorry, you can't eat that donut, or, so then mindful removals of sugar. That comes next.
I love hating on sugar.
I know. I
love hating on sugar. My favorite thing. So yeah, sugar is awful. It's worst.
Yeah.
It's the worst.
Yeah.
So decreasing the sugar.
Yeah.
So when I'm talking about sugar, I'm always only talking about added processed sugars.
Yes.
I'm never telling people to stop eating fruit.
Nope.
Especially like the whole fruit with the fiber. Like, you're good to go.
Fantastic.
Yeah.
Apple a day keeps the doctor away.
I'm not that kind of doctor.
I know. Not that kind of doctor.
Not that kind of doctor. So yeah, protein intake is huge. Fiber intake is huge. Decreasing the sugar is huge. Yeah. Awesome. So let's talk about how you, in your practice, help support women's healing.
Yeah.
What is it that you do, and how do you do it?
Yeah. So actually, my first visit is kind of like you do, a very long intake, as long as you need, right? So it takes me usually about an hour to an hour and a half. We're really diving deep into kind of where it all started for them, letting them tell their story. This is where things went awry, and trying to put together these puzzle pieces that maybe we're missing, patterns that they may not have noticed before. Oh yeah, that connects to that when that happened, and such. So we're really just like hashing it out, talking past medical history, medications that they're on, when they started those medications. I see so many women coming in. I take Vyvanse, I take Adderall. When did you start that? Probably about 3 years ago, because they told me I'm ADHD. Okay, at 35? And I mean, maybe, but where does this come? You know what I mean? Like, yeah, it gives you more energy, and it's a stimulant, and it helps me focus. For sure it does. Yeah, it does. But why did you develop ADHD at 35? At 37? It's like, again, this man. I'm not demonizing stimulants, or I'm not saying that everyone that every doctor that says you have ADHD, they're lying to you, or I'm not saying that. I'm just saying that sometimes these connections happen, like right around this time.
Yeah.
When my hormones started fluctuating.
And Jamie, asking the questions isn't demonizing.
No, I know, but I don't want to, of course, overgeneralize anything either. But these are just some of the things I see in my practice.
Right.
So that first visit is gathering information, setting goals. Top 3. Give me your top 3. In 3 months, 4 months, if you work with me, where do you want to be? What do you see your life like? What would be better for you? What could we make better in 3 months? Can you see yourself, getting back in the gym? Can you see yourself with no hot flashes? Can you see yourself with less brain fog, clarity, less stress, better sex? See it all. You know what I mean? It's all important. And each woman has different goals. Every woman is going to have something that means more to her than something else. If you walked all the time, but you've got this injury, it just depends. So intake is key, goal setting, fact finding, and getting patterns. And then I get a deeper dive into labs, blood work. I don't believe that blood work is everything. I think it's a small part of it, and it kind of reveals some things that maybe we can't check with just by talking to somebody, but your symptoms tell a lot of your story. And so that you're telling me these things and I'm already knowing what's kind of going on. I've get this picture. So then we draw labs, we draw blood work. We dive deeper than, like the surface level stuff. You go to your PCP, cholesterol, CBC, lipid panel, metabolic panel, maybe a thyroid function, maybe a vitamin D, no ferritin, no B12, no homocysteine, no inflammatory markers, no cardiovascular disease markers. So you have to fight for these things, right? You have to say, my hair is falling out. Can you check a ferritin level? Patients have to advocate for themselves, but I don't feel like that's the case. Well,
how can you when you don't even know what ferritin is or how that's connected to hair loss, right? So
right. But that's when they're told their labs are fine.
Yeah.
They get that surface level, and then your labs you're healthy. Right, I wish every 50-year-old was as healthy as you with this good cholesterol. And why do I feel like crap?
Yeah, absolutely.
So
you're using the labs as a small piece of a big picture.
Yeah, absolutely.
Not just the be-all, end-all.
No.
And if these numbers are okay, then you're fine.
Yeah.
Because obviously you're not.
Correct.
You wouldn't be here.
Correct.
Right. So apart from the labs, what other tools do you have at your disposal that you can really help, women get to their best health?
Yeah. I mean, for sure, I have part of my plan is, once we get the labs and we talk about the plan, then we have protocols. We've got a full care plan. We're working, 12 to 16 weeks together, one-on-one, setting new goals every week, incorporating nutrition, movement, stress support, sleep, sexual health, intimacy, socialization, making sure your screenings are up to date. Like, have you had a mammogram? Have you had, and these are all things that we talk about during our visits, but just kind of making sure as a whole, we're treating the whole person, not just the hormone fluctuations, or it's whole body, it's root cause care, and then referring out if we need to you, to pelvic floor,
root cause care, not just surface level,
right, because I know what I can fix and I know what I can't fix, and I don't treat the nervous system, I don't treat the bones. I can pretend like I can crack you. Just kidding. It's more than that, obviously. But, there's a certain level of you have to bring in your village and let these women know this is available to you. This is available to you. It's not just go see your primary care doctor, or refer you to endocrinology, or, sometimes it's needed, but as a group, we can help heal women and bringing all this together.
And I think that's super important because, kind of to wrap up here, women at Accordo Chiropractic always have a really special place here. And the reason why is because after the work that I've done for as long as I've done it, having grown up in a big Italian family, seeing my wife be the amazing mother and wife that she is, I know unequivocally that women are the health keepers for their families. And if you and I together can help improve the life of one woman, she's gonna improve the life and improve the health of her entire family.
Yes.
And from the ground up, if we take care of our women, we're gonna take care of our entire country. Yeah,
it's the truth. And I consider myself pro women and not necessarily a feminist, but I do think that women are such a vital part of everything, the family unit, in work, just in general. And if we help them fill their cups first, then they give out to all of them around, they can give to all of them around, all the people around them, better. We can serve others when we serve ourselves first, and taking that first step and just like showing up. Hey, this is going on. Can you help me? Yeah, we can. We can help you. And here's how we do it. We set a plan. We get them taken care of. So I wholeheartedly believe that women are the center of the universe. Can I be so bold? No, it's all a part, but it is a partnership. But again, if your wife is feeling like crap, she's not going to be able to provide good care for your kids. She's not going to be able to show up for you, and she's not going to be able to show up for herself. Mm-hmm. So how, we do have to, at some point, take our health seriously and advocate for ourselves and say, I have to put myself first for just a few minutes and figure out what's going on with me so that I can do all the things that I need to do and make the family and the work and the, everything run.
Yeah. So if I'm going to be bold, what I'm going to say is really, as a human being, but especially we're talking about women's health here, self-care is not a luxury, is what I'm going to say.
No.
And I'm going to be bold and say that it is absolutely part of what you need to do. It is a duty. Self-care is a duty.
Essential.
Yeah. There are too many people relying on you mm-hmm. for you to get run down, mm-hmm. broken, beat up, mm-hmm. sick, and unwell. Mm-hmm. Period.
It's the truth.